Hi, today we're going to talk about Ehlers-Danlos Syndrome. Just a little overview. The problem here is faulty collagen synthesis, which causes structural weakness in connective tissues, and that results in hyperextensible skin and hypermobile joints and a tendency to bleed, which is easy bruising. There are multiple types based on inheritance and severity factors. It can be dominant, autosomal dominant, or recessive, and it could be associated with joint dislocations, berry and aortic aneurysms, and organ rupture. So let's look at the types. There's the type 5 collagen defect, which is the classical type. Here you have joints and skin symptoms, and the genes involved, the mutations that are involved are in type 5 collagen, example COL5A1, COL5A2. Then you have a defect in type 3 procollagen, which is the vascular type, and here you have defect in or mutation in COL3A1. And here, this one includes problems in the vessels, example aorta, the muscles and organs, which are prone to rupture, example a gravid uterus. Before we move forward, let's look at a question. So, a 16-year-old male will present with a history of frequent joint dislocations, hyperextensible skin, and easy bruising since childhood. On examination, his skin appears thin with visible veins on his chest. There is no history of fractures, and he denies any recent trauma. His family history is notable for a maternal uncle who died suddenly of an aortic rupture in his 40s. Which of the following genetic mutations is the most likely responsible for this patient's condition? I think you already know the answer with the overview, but let's get into it a little bit more before we answer this question. So, the mechanism faulty collagen synthesis due to defective post translational modifications, example, pro-collagen peptidase deficiency. It impairs cleavage of pro-collagen into mature collagen, contributing to symptoms. The inheritance patterns, classic and vascular types, are autosomal dominant, and other forms may be autosomal recessive. The common associations are joint dislocations, aneurysms, perioaortic, organ rupture, gravid uterus, and intestines. The key features of Ehlers-Danlos syndrome: skin symptoms, hyperextensible stretchy skin that is often thin or transparent, easy bruising, tendency to bleed due to vascular fragility. In joint symptoms, you have joint hypermobility leading to joint instability and frequent dislocations. Severe complications include increased risk of joint dislocations, peri and aortic aneurysms, organ rupture, example, uterus and intestines. The types of Ehlers-Danlos syndrome: hypermobility type, which is the most common. This primarily affects joint stability, often associated with chronic pain. And then you have the classical type, which is mostly skin and joint symptoms. And this is caused by mutations in type 5 collagen genes, COL5A1 and COL5A2. The vascular type, which is most severe, affects fragile tissues such as blood vessels, muscles, and internal organs. Mutations in type 3 procollagen genes, COL3A1, associated with life-threatening complications such as aortic aneurysms, uterine or intestinal ruptures. Now let's look at some of the types and the key features. So in the hypermobility type, the key feature is that there's joint instability, there's chronic pain, and there are no major skin findings. The genetics are not so well defined, and the most common type diagnosis is clinical. Now you have the classical type. There's joint hypermobility, there's skin hyperextension, mutations in COL5A1, COL5A2, autosomal dominant defect in collagen type 5. Then you have vascular, there's thin skin, fragile vessels, organ muscle rupture, example aorta, mutations in COL3A1, autosomal dominant defect in type 3 procollagen, which is life threatening. Again, let's look at some of the okay, so here I have something. It's got hyperextensible skin, kinky hair, thin, translucent skin, visible veins, perianeurysms, and aortic rupture, defect in type 3 or type 5 collagen. Now, kinky hair, these are some buzzwords. So, kinky hair is specific to Menkes disease. It is not used for the Ehlers-Danlos syndrome. So, kinky hair is like a buzzword for Menkes disease. It is not a buzzword for EDS. Hyperextensible skin, thin translucent skin, visible veins, perineal aneurysm, aortic rupture, defect in type 3, whatever. These are buzzwords for Ehlers-Danlos syndrome. So there's no cure. You focus on symptom management, physical therapy, or joint stability. Monitor for vascular complications. Example, you do an echocardiography for aortic dilation. Avoid high impact activities. So coming back to the question, 16-year-old male is presenting with a history of frequent joint dislocations, hyperextensible skin, and easy bruising since childhood. So let's go back to the key features. He's having hyperextensible skin and he has frequent joint dislocations and easy bruising. Right. So, and then on examination, the skin appears thin, visible veins on his chest. There's no history of fracture, incisors, any recent trauma. Suddenly notable for a maternal uncle died suddenly of an aortic rupture in his 40s. Which of the following genetic mutations is most likely responsible for this patient's condition? So if you're saying COL3A1 type 3 procollagen, I think you're right. And that means you've understood whatever we've spoken about today.